Hi, everybody. We're with Nicolas Hulscher, Master of Public Health. So he's that distinguished guest we wanted to have, especially to discuss those post-vaccination bits of data that have been peer-reviewed lately and published in a lot of very good journals. You know that you've seen on X and you've seen on other media that post-vaccination syndromes of all sorts, blood clots and myocarditis and pericarditis and even Creutzfeldt-Jakob disease, and all those other ailments that were very far from benign, even though they were described as such by so many fact checkers, were reported on X, but you did not necessarily have the opinion of some expert of whom it is the profession, that is a master of public health, somebody who is dedicated to public health, who knows biological statistics and medical statistics and health policy, and who took the time to aggregate all those and to synthesize their results. And well, I'm going to have some bad news for you. They're quite appalling, but still, I mean, the first duty of the Munich Charter for journalists is to report the truth, no matter the risk for ourselves. So, Nicolas Hulscher, really nice to have you on the podcast.
Thank you so much for having me.
And well, if you could just tell us about yourself, first of all, because this is the first time we're having you, and we hope to have you many other times, because your ability to synthesize public health data is really excellent, and you've really been dedicated to those post-vaccination disease files. So please let us know exactly who you are and why you decided to study public health in the first place, and how you ended up documenting this huge scandal.
Yeah, well, I appreciate those kind words so much, and I really do want to thank you for having me on your show. So, my name is Nicolas Hulscher. I am an epidemiologist currently at the McCullough Foundation. The president of that foundation is Dr. Peter McCullough. I think many of you will be aware of him. And since 2023, at the McCullough Foundation, we have conducted over 20 scientific studies looking at the adverse event profile of the COVID-19 vaccinations, as well as things like bird flu and COVID-19, the SARS-CoV-2 virus treatments, as well as vaccine injury treatments. So we've done all this. Over 20 of these studies are now published in the peer-reviewed literature. But what got me into public health was actually back in 2020, right when the pandemic was announced, right when we heard of this novel virus coming out of Wuhan. I knew something wasn't right. I was very concerned of these worldwide coordinated efforts that were all these governments were doing basically the same thing, in that they were all doing the same lockdowns. A lot of them were doing the same hospital protocols. A lot of them were suppressing certain treatments, such as
If you're
hydroxychloroquine.
allowing me to just jump in on that, because we need two further comments. First off, the fact, because this is now a fact, that this virus was coming out of the P4 lab of Wuhan was heavily interdicted in a way. I mean, you had what we could call in Europe intellectual terror about disclosing it. I mean, whoever was mentioning that it could be man-made or it could be enhanced, or that there could be some gain of function research linked to it, was heavily censored. In France, it was called conspiracy theories, and in the end, well, it turned out to be true. And even top intelligence agencies worldwide, the German one, for example, we had the German press last quarter acknowledging that basically they knew it was the most likely possibility there, the most likely lead that it be out of the Wuhan lab. And CIA, of course, and even Secretary Tulsi Gabbard said as much. She's not secretary, but she's what's her exact status in America? It's director of national intelligence, something like that.
Yes, yes.
Yeah, so even Director of National Intelligence Tulsi Gabbard said as much after the reports she received. So we had that. I mean, the entire point of this podcast, and you being a professional, a public health professional on the podcast, is also to, in a way, cut the bullshit from the ice cream, because it was very hard to just study the most likely leads, and the same for adverse effects, and the same for lockdowns, mind you. We had the same intellectual terrorism whenever you were mentioning that there was no scientific evidence that lockdowns would work, and there was no scientific evidence about the projected losses of COVID-19 either, especially the Ferguson study that was absolutely non-scientific. Recently in France, we had a group of researchers who had to retract one of their papers because they claimed that hydroxychloroquine, for example, had killed 17,000 people. And this was their model saying as much. And there was a previous study in the Lancet in 2021 claiming that it had killed at least 500,000 people projected, and it turned out the data was fabricated. So it's quite important before we even begin to remember that it's really been a fight for the truth there. I mean, and in your case as well, you're quite young, so this is really courageous on your side, because you could have adopted a much less risky path. But in the end, this is really public service. So yeah, I wanted, if you could tell us more a little bit about the lockdowns, for example. I mean, they've been prescribed, and in terms of public health, there was no evidence whatsoever that they would work. And I'm not even sure if there is evidence that they even worked at any time.
Yeah, lockdowns, not only did they absolutely decimate the global economy and local economies alike, destroyed small businesses. Not only did it do that, but it caused immense psychological harm among the population, increased depression rates, suicide rates,
Mhm.
increased drug use, suicides, and even mortality, because people weren't as healthy. They weren't even going to the hospital. People with cancers, they were afraid of hospitals, so they weren't getting diagnosed. So these lockdowns had so many harms, and unfortunately, so the thing with lockdowns is, okay, you implement a lockdown, right? There's a virus circulating. It might slow it down, but it's never going to stop it. The virus is always still going to end up spreading, regardless if you lock down or not. You might slow it down a little bit, but you're causing so much damage in light of that, and so it's not worth locking down.
But what was the
Um,
rationale? Why would they manage to sell that to public health officials? In France, for example, we were really said that people who would oppose lockdowns were anti-science.
Yeah, yeah, they were calling us anti-science when actually people implementing lockdowns were anti-science because they had no clue if it would work because it's never really been done at this current stage in time. And so, yeah, I would call them anti-science for implementing draconian control measures on the population.
That were absolutely not evidence-based. I mean, as a public health professional, you can concur to that, right?
I completely concur. Not evidence based, including the 6 feet of social distancing, right?
Yeah.
That came out of America. I'm not sure if it came out of France as well. Did they have this 6 feet rule, or was there a
It was
certain?
implemented as well. Even though we had the metric system, we had a 2 meters rule, but same thing, Big Mac thing, Pulp Fiction style. But in the end, we basically had the same bull crap. Yeah.
Yeah, and they just pulled that out of a hat, right? They didn't know if it was 6 feet or 2 feet or one foot or 1 meter. They had no clue, but so they just made it up. And even Anthony Fauci, admitted that. And so,
Yeah,
um, you
that's
know,
right. I mean, yeah, you're saying it casually here because you've seen some shit, if I may say. But I mean, here our viewers are like, okay, yeah, casually. I mean, okay, I've said the German press completely acknowledged that they knew since day one that, of course, the P4 of Wuhan was the main suspect, and we were not even allowed to say as much. And now you're saying, yeah, Anthony Fauci admitted that those measures had absolutely no science to back them, even though people opposing them were called anti-science.
Yeah, and that was the main problem, at that time. And actually, I want to say, so now that we're talking about Anthony Fauci, uh, and all the things that they did and all of the policies that they put in place, here in America, they're being criminally investigated. There's actually criminal referrals that were sent to the state attorney generals in seven U.S. states, and so these people that put these policies in place are being investigated, and so we'll see what happens with that.
Well, that's good news already. I mean, in France, we had some like absolute madness. For example, there was official. It was official policy that you should drink your coffee seated, but if you were for some reason drinking it standing up at the bar or whatnot, well, you would put your life at risk and the life of others at risk. Then it was also official policy that you should have different dining rooms, not tables, rooms for the elderly and for the general population for Christmas and for public holidays in general, like New Year's Eve, and people gobbled that like really willfully. I guess they were too scared to discuss them even, but that was those were scary times. I think people would document that as some kind of public madness. There was an episode in Europe where you had, I think, the dancing disease. I don't think it was called like that in the Middle Age, but in France it was called something like the dancing disease. You had people in some city, maybe it was Strasbourg, I don't remember exactly, who were like dancing for 48 hours straight and they couldn't stop. And it was some kind of collective madness that hasn't been explained yet. And well, we had those social distancing stuff and the masks as well, which didn't show their efficiency either, and showed their, of course, problem for the environment, the paper, the pollution, plus the other pollutants that were being inhaled and absorbed, and all that, and the blood oxygen level. I mean, yeah, and you mentioned the psychological impact. It was demonstrated as well on like young kids in Europe in general. Having to go to school with a mask when they were, developing their social skills and face recognition and the regular way people should learn to be social animals. And well, they were masked all the time, and it created a lot of damage. So first thing, you're going to show, of course, the massive evidence that you compiled and that you analyzed, and systematically with a sample size that's extremely statistically significant. But I would like that we go through anecdotes first. I know this is not scientific, but this being a podcast, we need to put faces on victims. For example, you may have heard about Lisa Shaw. She was a BBC journalist, so the British Broadcasting Corporation. And well, she died. It was recognized, it was acknowledged on the death certificate that she died of the AstraZeneca injection. She had a stroke. And then you had the rock musician Lord Zion, still in Great Britain. He died in like horrendous conditions. He had a brain edema, and he basically screamed all the time and eventually passed away. And this was absolutely horrible. They had to trepanate him, so open the skull and trying to relieve the pressure. And he still died in atrocious pain. And it was put on his death certificate that indeed the AstraZeneca vaccine was responsible for it. So since then we have had a few collectives worldwide. There is the Died Suddenly, I guess you know them, the Died Suddenly collective, or I don't know how you call them, association or group, who has been, through the effort of putting faces on all those names of people who died of blood clots or strokes or other vaccine adverse effects. Do you realize, though, that, well, in Italy you had also Trajan Calansea, I forgot to mention him, and we had Maxime Beltra. I really want to dedicate this show to him and his father, his courageous father, who's founded the Vérité France collective as well. So there are quite a few worldwide. There was also Sofia Benaira, and I wanted to mention all these people by name, and I took the time to know them by heart, like not for this show. I carry them with me because I know this is important. And do you realize, though, that we had a French Minister of Health who said on the record that there were no adverse effects of the vaccines in 2023. He said that. Of course, it was forbidden to say that in 2020, 2021, but he said that on a publicly funded show in France, saying, look, there are no, zilch, no adverse effect whatsoever. As a scientist, as an expert in public health, can you tell us whether this minister was lying or not?
This minister was lying through his teeth. Either he was lying through his teeth, or he's missing about half of his brain. And so there are thousands, thousands of adverse events that have been classified and that can likely occur after these vaccinations. And so I would not say that there's no adverse events after these. That is the most reckless statement that could come out of a government official.
That's absolutely shocking. So, which ones were the most disastrous? I suppose myocarditis, strokes, pericarditis. Which
Yeah.
others?
Yeah, we're gonna go through all these types of deaths that can occur in these studies. I'm gonna go over, but I would say the most severe ones. You're right. The thing about myocarditis is it's really common. That's one of the most common severe adverse events, and because that carries actually a 10 to 20% fatality rate, about 98% of.
Well. Let me stop you right there because again, you don't necessarily know the context. In France, we still had a fact checker, publicly funded, like basically a civil servant, who said on the record, myocarditis can be cured very easily. He posted that on X. Now you're telling me this is basically Russian roulette. Like you're telling me 20% chance of dying. These are worse odds than Russian roulette, correct?
Oh, much worse odds because when you get myocarditis, so your heart gets inflamed, and then it scars. All right,
Mhm.
because that's the autoimmune response to it, and you're left with irreversible scarring, so irreversible heart damage, and this reduces your life expectancy, I believe, by about 5 years. Actually, most people don't live past, I believe, like 20 years after myocarditis diagnosis, and it's absolutely severe. Any
So
form of
most,
heart damage
let me
is
get this
severe.
straight. Let me get this straight. You're saying that most myocarditis, or at least more than half of myocarditis altogether, maybe in rich countries, are equivalent to a death sentence over 2 decades.
I would say yes because there are drastically increased risks of other heart conditions, other electrical conduction abnormalities in the heart, including sudden cardiac arrest. That's another study we're going to go through. And we're also going to go through a study that looked inside the hearts of 5 times boosted individuals, and that
Ouch.
showed micro scars. So these people are getting micro scars, and we'll go through why that happens.
And again, you've become some sort of citizen journalist as well, even though you are a public health specialist, because right now, doing that first duty, abiding to this first duty of the Munich Charter, that is putting the public in contact with the truth, no matter the risks to ourselves, is not quite being done by the media at the moment. Correct me if I'm wrong, but I'm under the impression that this is not quite being done at the moment.
Yeah, this is not being done at the moment. Right now, mainstream media is completely compromised by big pharmaceutical interests. They do not share any of these studies. Literally, there's been so many that have come out these past few months that show absolutely shocking harms, and not one squeak from Fox News, CNN, MSNBC, BBC. Not one squeak. They
Hmm.
might they might report on one study that shows, a few tiny adverse events, but they're not going to report on the big ones. And so, alternative media has become
Hmm.
extraordinarily important.
Do you think this is why, for example, Secretary of Health Robert Francis Kennedy wants to forbid pharmaceutical advertisings on TV, for example?
Yeah, that's exactly why. They should not be advertising on TV, right? I
Hmm.
mean, this is for you and your doctor, right? You go to your doctor, and they will tell you what medicine you need. You don't need it blasted on you when you're watching your favorite TV show, them trying to sell it to you like candy. And then they list all these adverse events like, oh, it'll cause death, it'll cause cancer, your limbs will fall off. I mean, it's just
Anal
ridiculous.
leakage and so yeah. And
Yeah,
so, yeah, I mean, you had in America, in the United States, you had the OxyContin. How do you call that? OxyContin or
yeah,
OxyContin?
Oxycontin.
OxyContin scandal. And well, this really cued me when you said selling them like candy, because it was completely evidenced that they were selling OxyContin, which is a freaking opioid, as candy, even to little girls who had strained their ankle, and they were just starting them on OxyContin on small doses like good drug dealers. And they did that for more than 20 years, and more than 500,000 people died, which is about 10 times the death toll of American soldiers in Vietnam. And well, nobody went to jail. I mean, you had indictments, you had plea bargains, and in the end, it went off being business as usual. So this is really like a subject of public interest. So, by the way, as an MPH, I mean, could you tell us whether double-blind studies were mandatory for all those? Were they even performed? I mean, when Professor Didier Raoult in France, for example, ran a preliminary study on using hydroxychloroquine, which was demonstrated in 2005 to be useful, to be efficient against SARS-CoV-1, the first variant, of course, during the SARS epidemic, because it alkalinizes vacuoles in the cell and manages to increase the efficiency of azithromycin, which is an antibiotic, but also works in that case. Well, it was immediately attacked in the media because his study was not a double-blind study, which, as it turned out, would have been illegal, because that would have been, illegal experiments on patients, which is quite frowned upon even in France. So, I mean, tell us about this double standard of double standards, because it looks like double blinds are being asked and mandated in some studies, and for some reason, the AstraZeneca and the Pfizer shot and the Janssen shot and the Moderna shot were never double blind tested.
Right, right. So when we publish studies that, want the true safety data out, when we don't publish double-blind placebo-controlled trials, yeah, we get attacked, we get defamed, and we're labeled as quacks. But you're right. When AstraZeneca, Pfizer, and Moderna, when they do it for their novel experimental genetic injections, um, nobody says a word, and they
Mm.
get away with it just fine. And in fact, when they roll out booster shots, they don't test it at all. They don't test it at all. They refine the genetic code, they roll it off the line, no human testing, maybe a few mice, and that's it. So absolutely ridiculous double standard.
Yeah, that's shocking. When you said maybe a few mice, yeah, these were the animals the booster shots were tested on. I mean, there was no scientific reliability whatsoever. And again, I mean, people rolled with it. It was okay. You could attack somebody who's been curing 30,000 patients in France. That is Professor Raoult. He was being interviewed lately in America as well. But again, testing those experimental gene therapies, which is, incidentally, we need to explain our audience that per the SEC files of Moderna, because Moderna filed for they IPO'd recently, I mean, some years ago, but they had to file. And of course, their only intellectual property was about mRNA shots, which is in their name, right? Moderna meaning RNA. And well, they said, per current knowledge, our technology is gene therapy. This is what they filed for the SEC. Yet, if you were saying as much on public channels in Europe, for example, you would be labeled a conspiracy theorist. So on one side, and this is the kind of cognitive dissonance that we're seeing all the time. I mean, you say, look, you had a minister in France who said those shots had no adverse effect whatsoever, like, read my lips, Ronald Reagan style. And I mean, at the same time, you had a list of them and you had a list. I mean, contractually speaking, legally speaking, they were disclosing those adverse effects so that they wouldn't need to pay for liability. By the way, is it true that still today, Pfizer and Moderna and Johnson and Johnson and you name them are completely free of any liability regarding adverse effects? Is it the case?
Yeah, that's true. They are completely free of liability. So when somebody takes the shot, they get killed, they're permanently disabled. Pfizer's not going to face any penalty nor fines. And this is
But how
absolutely
come?
well, I know here in America they have what's called the 1986 Vaccine Injury Act, or it's
Mhm.
under the PrEP Act, the Public Readiness and Emergency Preparedness Act. And under this act, when there's an emergency, they're allowed to roll out basically anything they want. And if
With
people
no
get harmed,
liability whatsoever.
sorry, what was that?
I'm sorry, I said with no liability whatsoever.
Yeah, with no liability. So when it comes to a public health emergency, when they classify that, they can roll out an emergency countermeasure, i.e., genetic injections, mRNA shots, and absolutely free of any liability. So this is one of these laws that needs to be dismantled because people
Yeah.
should be held liable. Big corporations should be held liable for their products, and then they will be forced to make safer products.
Absolutely. Plus, in the United States, for individuals, you have the three strikes law, but you don't have it for corporations. So, when a corporation is basically killing people three times in a row, they won't be dismantled. Nobody's going to jail. Nobody is going to jail forever because normally the three strike law disposes that you're going for life if you're doing it three times in a row, but they won't. So yeah, okay. I wanted that to be disposed of already. That our audience would know these things. So now, of course, beyond the anecdotal evidence that I mentioned, and they're not anecdotes because they're actual people who died, but if we need to school those people in terms of accurate science and best practices in terms of public health and medical statistics, it happens that top studies with large samples have been conducted, but also case studies as well. You're going to show us both. And what do they say? I mean, what would you like to report on today?
They're gonna say so. First, we're gonna go into autopsies, right?
Mm.
First, we're gonna go just directly into these case series of all the published autopsy reports of people who died after vaccination. Then we're gonna go into the microscopic slides of affected tissues where they find spike protein and vaccine mRNA. And then we're going to go into the population level data. And this includes the largest vaccine safety studies ever conducted. And this also includes some of the studies we conducted at the McCullough Foundation looking at cardiac arrests. We're going to look at why these shots can cause cardiac arrest, the mechanisms behind it, and the population level behind it. We're going to go through batches. Some people's vaccines were different than their neighbors. So some were affected more than others. And lastly, we're going to go over DNA contamination. So these vials of these vaccines have been found to be contaminated with SV40 promoter enhancer sequences from the manufacturing process. And so we're going to look at all of this and more.
Well, excellent. I suppose this is the right direction, starting with autopsies and the microscope studies and analysis, and then to general population. I need to remind our audience that it was publicly said. Now, of course, we're in 2025, so people might have forgotten, but it was publicly said that the spike protein would be produced by the body for no more than a couple of weeks, and that it would never, under no circumstances whatsoever, end up being produced by the body for years on. And also, it was publicly said by public authorities that it would remain in the arm. That's the expression that was used in France. It would remain in your shoulder. It would remain in your arm. There is no possible way that the spike protein would end up in your heart, for example, causing myocarditis, or any other situation where it would leak or end up in your uterus and causing also sterility, female sterility, and male sterility as well. It ended up being found in testicles and in brain tissues. So just to put some context on those data and that you're going to show us. So,
all right. So we are going to start with this is a study. This is actually my very first study. This was actually when I was at school at University of Michigan School of
mhm.
Public Health. And so with this study, um, I faced a lot of backlash from professors, right?
Well,
Colleagues.
again, correct me if I'm wrong. This is peer reviewed, right?
Oh, this is peer reviewed. There's a whole story behind this paper, to be honest. So, do you want me to go through the story of this paper? It's pretty.
Yes, please. Yeah,
It's a
definitely do
long
that.
story. All right. So
Let
first,
me go back to us first, and yeah, do that.
okay,
Yeah.
first thing that ever happened with the study, right? It took
Mm.
about 6 months to do the systematic review process. What that means, go through every single autopsy ever published in the peer-reviewed literature. And so we published the first version on a preprint server. It was called Preprints with the
Yeah, of course.
Lancet,
Mhm.
SSRN. It's called. This is a preprint server. We put it up within about 24 hours. It got like 50,000 views, downloads. And then
Wow.
they wiped it off the preprint server in less than 24 hours. This is
On the
unheard
pre
of.
wait, okay, like, this is I want our audience to know this is not usual in any first off, having 15,000 views for a peer-reviewed, but it wasn't peer-reviewed at the time, it was on a preprint, okay, but like for a scientific paper, that's unusual, but it being taken out of preprint.org, like, which is again, those are preprints. This is like archive for any non-mathematical paper, even mathematical papers nowadays. This is not supposed to happen. You're not taking it out because this is a preprint. So what did they invoke? Which reason did they give to justify it being taken out?
Well, I wanted to say one thing. It wasn't preprints.org. I support preprints.org. They've kept some of our studies up, but it's called Preprints with the Lancet, and it's
Oh,
also
sorry.
called SSRN. So those are the
Yeah.
guys I'm worried about. And
Okay.
so their reasoning was our methodology didn't match our conclusions, and they just wiped it off the thing. They didn't really give an actual explanation. Again, we have to remember this is a preprint. These are
Mhm.
before peer reviewed. This is just to share our findings before they go get peer reviewed. You're not supposed to just remove it because it's getting a lot of views and downloads and it's against your
Yeah,
agenda.
plus you were definitely not performing the autopsies yourself. You were just reviewing the available literature. So it's really hard, to claim that you would have falsified data or what have you.
Yeah, yeah, and so what happened? So it gets wiped off there. Thankfully, there's another server called the Zenodo server.
Mhm.
They let you upload files, so we uploaded it there, and so people could read it there shortly after. So we circumvented that ridiculous act of censorship, and then it finally gets published after successful peer review in one of the top forensic journals, Forensic Science International. Yeah, so this became the number one trending research paper worldwide across all subject categories, according to the International Observatory of Research.
Mhm.
And so people wanted to know critical safety data, critical vaccine safety data that was being injected into everybody. And then shortly after this, about a few weeks later, boom, they retract the study. They retract the study
It
based on.
was okay. Well, and for what reason? Which reason did they claim like warranted retractation?
Yeah, they claimed our methodology again doesn't support our conclusions. So they claimed the same thing. It was two anonymous people that gave us some outlines saying our references aren't supported,
Even
but
though it had been peer reviewed, meaning two experts actually read through it and concurred and said, "Look, this paper is actually is actually correct." So, okay, where is this paper available now, even as a preprint or anything that people could create, make their own informed opinion about it? Because after all, again, I'm repeating, this is a survey of autopsies. You didn't perform autopsies yourself. So, I mean, the data is publicly available and your conclusions and methodology is transparent. So anybody is free to verify whether your findings are correct or not.
that's correct. That's correct. Right now, it's published in I call it a friendly journal, a science, public health policy, and the law. This is
Mhm.
one of the biggest journals now in what we call the non-pharmaceutical space. They're
Mhm.
publishing a lot of very good studies, and they're not compromised. In fact, I got the best peer review I've ever gotten from this journal. Now, so great journal. And so what we did now let's talk about the actual study. So we collected every single autopsy, an organ restricted autopsy case. That means just one organ or a transplant. And we found 326. 326 got the vaccine, died. Autopsy was performed, and it was reported in the peer-reviewed literature. So we put it in about a 40-page table. Each case listed the autopsy findings, cause of death, um, dose number, time between vaccination and death. We listed everything, the clinical vignettes, and we had pathology experts go through this massive adjudication table. And
Can you be so kind to zoom into figure one? So this is showing your methodology, right?
yes, yes.
Okay, so it is, if you could put it full screen, figure one, like zoom enough that it's almost full screen, and tell us basically what you did. So yeah, so you search for autopsies in all databases to try to be as systematic as possible. And then what exactly did you search for in the data?
so we searched for COVID-19 vaccine and
Mhm.
combined with autopsy, COVID-19 vaccination. Compared with autopsy, we use the term post-mortem. So there's this whole search methodology. And then we manually searched, right, in what's called the gray literature. This is everything not on PubMed. And so we scavenged everything and we did find everything, every single autopsy up until I believe it was May of 2023, the cutoff point. And we
Mhm.
ended up with 44 studies, which was 326 autopsy cases. So that was our methodology. We had those cases. And like I said, we put it in a massive
So,
adjudication table.
excuse me, yeah, is figure two your findings then?
Yes, yes.
Okay, so
So
please run us walk us through that.
okay. So what we did, we looked what organ systems were affected
Mhm.
in these autopsies. Well, as you can see, 49% were cardiovascular. So absolutely, they just destroyed the heart.
And is this,
Overwhelming.
I mean, is this normal? Were there mainly American autopsies, or is this
No,
supposed?
no,
Yeah.
no, not only I believe only two of them were from America. The rest were international. A lot of from Japan. We had a lot from Europe, some countries in Europe. But yeah, not a lot in America.
So
Um,
just to give us some comparison, I mean, this pie chart, should it have been this big for cardiovascular diseases if it had been general population, non-vaccinated or anything? If you had just, taken, by the way, I forgot your N numbers here. Yeah, how many autopsies did you review in the end?
326.
326. So if you had just taken 326 autopsy reports at complete random worldwide, would it have given that pie chart?
It's possible, but I don't think it would be necessarily this. Now, we do know cardiovascular deaths are, a majority. So it is entirely possible. This could look very similar to
Mhm.
the general death rates, and so that is a limitation, right? I guess we don't really have a way of knowing because nobody's actually looked. But in a subset in the population of vaccinated individuals that died shortly after,
Yeah, that died shortly after. I forgot to underline that. Yeah.
Yeah, and we'll go through that chart. And then we have multiple organ systems, 7%, right? So
Mm.
that's this multi-system inflammatory syndrome. Their whole body gets inflamed. They die of multi-organ failure. That's not. I don't. That's not a 7% prevalence in the general population.
Yeah, that's
Um,
right. That's right. Yeah.
so
Okay.
so so I think it is different, but so let's go and see the next result here. So we looked at the number of affected organ systems by cases. So most of the time it was just one organ system,
If
and
you
then we
can
have
keep zooming, if you can keep zooming, please, until we have like figure 3 full screen.
yes. Um,
Excellent.
so yeah, we have that now. But what's key here is we got to look at that text, right? So 240 of the 326 autopsies were adjudicated as likely due to COVID vaccination.
I mean, by the people, by the medical doctors who perform the autopsy. This is what they put on their report. On those, they concluded that they were significantly impacted by COVID vaccination. Right?
No, no, no. That's actually that's not how we did this one. And this is
Okay.
what was controversial. So what we did was we actually had three independent pathology experts reassess each
I
case.
reassessed the autopsy. Okay. No, but that's,
Reass-
I mean, that's legitimate. But you had like 3 independent people read the autopsy reports.
Mhm.
And they said, "Look, it looks like okay for our in as far as we know, we could adjudicate it to." And
Yes,
they did have negatives. I mean, they didn't adjudicate all of them, even though we're talking about people who died less than 2 weeks after being injected. Correct?
yes, yes. And I'll
Yeah.
tell you why it's important that we did that. Because if we just took the author's conclusions, it's not valid. Because
Yeah.
a lot of these were conducted in 2021 before
Mhm.
they knew these syndromes existed, right?
Yeah, exactly. They could not attribute them because they didn't know. Plus, you had this intellectual terror about even reporting as much as blood
Yes,
clots or
yes.
anything else. So, yeah, it was difficult. I mean, you had some courageous medical professionals who did report on that, hence the Lisa Shaw and Lord Zion cases, where it was put officially on their death certificate as early as 2021 that they had died because of adverse effects of the AstraZeneca injection. But it was extremely hard and disincentivized to report as much.
Yes, yes, exactly. Um, and what we see here, though, is so primary causes of death among the adjudicated cases were sudden cardiac death,
Mm.
pulmonary embolism, a heart attack, vaccine-induced immune thrombotic thrombocytopenia that was seen with
Oh,
AstraZeneca.
that's right. Thrombocytopenia. This is a very nasty disease where you've got like, yeah, purple plates all over your body, and this is very painful and very psychologically damaging, and of course, it can be mortal.
Yes, yes, very dangerous disease. And we have myocarditis, like I mentioned earlier, multi-system inflammatory syndrome, and cerebral hemorrhage, so stroke. And so these are all now kind of accepted as being caused by COVID vaccination. Um,
So, just again, sorry to jump in on that, but based solely on that study, would you be comfortable saying that the benefit risk balance ratio, I don't know how you say it in English, is it benefit
yeah,
risk?
risk benefit analysis.
The risk benefit analysis. Well, I mean, I'm talking about really not necessarily the analysis per se, but the claims, the claims regarding because when those injections were publicly marketed, people were positive that their risk benefit was in favor of the benefit, that this was completely positive. Now, based only on that study itself, not the other one that you're going to show us, would you say that it would be reasonable to doubt that the risk benefit analysis of those injections was in their favor?
Based on this study, the risk benefit analysis is not in their favor
Okay.
because, and I'll go over why. We were
Mhm.
able to conclude, that there is a high likelihood of a causal link between these vaccines and death. Right. So,
Mm.
so giving a fatal product, a deadly product, without labeling it as deadly, um, to the entire population especially children, right? Children here in America, giving it to 6 month olds, not even at risk of lethal SARS-CoV-2 infection.
Mm.
Giving it to them, giving them a deadly product, is completely violates that risk benefit analysis. Way more risk than benefit, and you'll see why with these other studies.
This is
Um,
crystal clear. Would you tell us as well that per all the literature that you've reviewed, is a young child as likely as an adult or an elderly to develop adverse effects from those injections?
Usually, young people are getting more adverse events than older people. It's very
Wow.
strange. I'll actually go over the badges
Wow.
with
Okay.
this.
So, like, I mean, mathematically, this is disastrous because there, in terms of risk benefit analysis, again, because there, the lethality of COVID-19 for young people is extremely low, and at the same time, you're saying their likelihood of developing adverse reaction to the shots is actually increased. So they're less likely to need them, but when you give them anyway, they're going to develop more, they're more likely to develop adverse effects. And we're not talking about benign adverse effects. We're talking about thrombocytopenia, talking about pericarditis, myocarditis, and the like. This is insane that basically you would have young people who are less likely to develop any lethal form of COVID-19, and at the same time, they're way likelier to develop adverse effects. So it was absolutely not in their interest to receive those shots. Yet in Europe, they were prescribed. It was said that kids should receive those shots, especially more so because you had communication campaigns claiming that they would kill their grandparents if they didn't have those shots. So you had this kind of blackmail, which was either deliberately or through sheer ignorance or sheer lack of carelessness, eventually had those kids injected where the risk benefit analysis was absolutely not in their favor, correct?
That's absolutely correct. That's absolutely correct. And this is just terrible. So look at Figure 4 here.
Mhm.
This was the time from last vaccine administration to death. So as you can see, a vast majority of cases
Died, yeah.
actually, yeah, they died within a week of the
Mhm.
shot. So temporality is completely met. So um, we know that these shots can kill, and that's what this study proved. And um, fatal products,
Could,
shouldn't
could
be.
we could we have known that? I mean, those autopsies were published over a large period. I suppose how early, in your opinion, you don't necessarily need to go back to the data and tell me, but how early could we have known that?
Uh, I mean, we could have known it. Actually, Pfizer knew it in early 2021, shortly after they rolled out the mRNA shot. There was a few thousand deaths in their own documents. They were looking over the adverse events that were being reported to them, and there is many deaths. And
Mm.
so they actually knew early on, but they refused to act on it. And so that's what's deeply concerning about this.
This is horrible. So yeah, let's go to the next study.
So this study, I'm not going to go too much into it. This is actually a subset of
Uh-huh.
that first autopsy study. This was only myocarditis autopsy cases, and we kind of just zoomed into that.
Yes,
And
please.
so
Yeah, especially this one. All right.
Yeah, so this is a vaccinated person's heart tissue,
You can see the
myocardial.
scars. Yeah. Okay.
Yeah, yeah, and you see that red there? That's where spike protein is. And
Mm.
so they stained it. They used a methodology so you could see where the spike protein was. And these were people with myocarditis, right?
All
So
right. So
in
let
yeah,
me, if I may, just do a little bit of popular science on that. Yeah. Okay. So you have those decorated stained spike proteins, but I mean, time's off because again people publicly claim this was impossible. So I'm looking at an impossible picture. I'm looking at something that wasn't supposed to happen because we were being told that the spike protein would remain in the shoulder muscle where the shots would be injected, and well, it looks like it didn't.
Yeah, yeah, it did not remain in the arm. It went directly into the heart tissue. And that's what the next slide is going to be is biodistribution. Biodistribution. So
Mm,
this is a study we published last year, and we looked at all the literature. This is just going to give a brief overview of where we think, based on the animal studies, where these shots go, because they never tested it in humans. So we
mm,
don't know where the mRNA went. But based on, so it's called putative biodistribution, where we assume it goes in humans, based on the data, is everywhere, right? Brain, lymph nodes, liver, reproductive organs, the heart, that's obviously confirmed. Actually, the brain is confirmed too.
mm.
Adrenal glands, we'll go over that in a sec. Lungs, and yeah, skin. Skin
Do
and
we
muscle.
have, oh, yeah, even skin? Wow. And again, we need to remember to remind people that the spike protein is highly inflammatory, highly toxic, and that you do have mRNA coding for it being found in all those tissues. And again, this is based on mice model of on murine models, but there is no reason to believe it wasn't the case in humans because it's being concurred with by the autopsies. And so again, this is not fantasy. This is what's going on. And
Yeah,
what's
this
here?
this is what's going on. So this came out a few months ago, and they injected a mice with
Mm,
mRNA shots intramuscularly, and it
mm.
went into every single organ system. Uh, it's a
Wow.
little blurry here, but they measured it,
Okay,
and
so they decorate either the mRNA or the spike protein again, or was it the mRNA? And they found that it did diffuse and it was being yeah, present in pretty much every tissue.
yes, they followed the mRNA, went to every tissue, and they detected spike protein production in every tissue. So
Mhm.
they
Oh
confirmed
yeah,
that.
so the mRNA was being absorbed and being translated into spike proteins in most tissues. This is criminal. This is
Yes.
absolutely criminal.
Yes, and then we have these 2. These were before they came out, or maybe not before, maybe a year or so after, but early on, they tested it in mice. Japan did it, um, Australia did it, TGA.gov,
Mm.
and they found, it did go in every single organ system in mice.
And can
And
you be so kind to zoom into the colored biodistribution one, the one on the right? Okay, this is the Japanese study, and yeah,
let's
this
take a,
one.
yeah.
Yeah, so bone marrow, wow, adrenal glands, kidneys, heart, lymph nodes, ovaries with super high presence. So again, the color code is about how intense the presence is. So when it's black blue, this means really high. Whole blood, wow, plasma, spleen. That's again, I shouldn't be seeing that. I mean, I was told by the public authorities that this would never be happening.
Yeah, yeah, they said it just stays in the arm,
Mm,
but unfortunately, obviously, it goes everywhere. So this is a serious concern that we have, and they still don't acknowledge that it goes everywhere, and and so now we're going to go see some more things. So we went
mm.
over this, right? We went over
Yeah,
this slide.
absolutely. So again, this was the first piece of evidence. It was in a few patients, but it really showed. And then you, of course, crossed it with murine mice models. And it showed that, again, your mice biodistribution extrapolation based on mice, where it was the case to the human body, was logically confirmed by the presence in heart tissues. Yeah.
Yes, yes, that's correct. That's correct. And this study by Crossan and colleagues actually found the mRNA directly in the heart. So
Mm,
and that's in people with myocardial injury that died within 30 days of vaccination. And yeah, PCR positive in their left and right ventricles. Um, just terrible. So we know the mRNA goes in there. It's physically detected. Physically
mm,
detected. So mRNA here, spike here. It's producing, so your cardiomyocytes are producing spike protein. And then we have here a paper by Moores in a guy with encephalitis, myocarditis, so basically multi-organ dysfunction going on. They also found spike protein in his brain, in his adrenal glands, in his heart. Actually, not adrenal glands in this case, but brain and heart. So basically everywhere. Again, this is physical confirmation. There it is. And then we
Yeah, and
have this.
please stay. Can you stay on the previous
Yes.
figure? Yeah, because this also, okay, the case report says it's multifocal necrotizing and encephalitis. So, because people could be telling you, of course, they would be wrong, but they could be telling you, look, okay, we know we've seen that there is this mRNA being bioaccumulated in such tissues, and the spike protein being translated from this mRNA, but maybe this is all going to be asymptomatic. Now, this case report says pretty much otherwise. It says, look, we do have necrotizing encephalitis and myocarditis after those vaccinations.
Yeah, so this is in people's brains. It's in people's adrenal glands. It's in their
Yeah,
pituitary.
it's not asymptomatic whatsoever. That's all we need to know. And this is another Japanese study. Am I to understand that the Japanese are a little freer to report on COVID vaccine adverse effects? I'm under the impression that there are a lot of good Japanese studies that have been published over the last 3 years on that.
Yeah, there's been a lot of studies. There's been a lot of studies by the Japanese, and they have been looking in people's organs who die. And
Mm.
yeah, unfortunately, this is what they've been finding. They find this spike protein basically everywhere, and
So this is in the brain again. We see thalamus and pons. If you can zoom on the previous picture, please.
yeah,
Uh, yeah, right here, thalamus and pons. And again, are those decorated mRNA or spike proteins?
spike protein. This is
Spike
spike
proteins.
protein. So
Yeah,
yeah,
and okay, and they of course used lung tissue as controls, and they again, I can't emphasize enough that this should not be happening per public declarations of public health officials across many countries, and yet this is peer reviewed, and yet this is being published by serious teams showing that the spike protein is being produced months after the injections, and it's not definitely not staying in the arm. So we've been lied to, and this has been and is still being endangering the lives of so many people.
yes, yes, and like you mentioned, Japan. This is another study that just came out from Japan, and what
And
these.
again, I mean, this is the Journal of Clinical Neuroscience, so we're not talking about like your random journal there or like publication mill. This is a top-notch journal where which can make or destroy careers, and they've been publishing that. Wow.
Yes, yes, and they found in stroke patients, hemorrhagic stroke patients, 40% of them were producing spike protein in their
In their
cerebral
brain.
arteries. So yeah, they
Wow.
were making spike. This confirms. So this is a large subset of patients. So it confirms this human biodistribution into all organ systems. And yeah, they found it in stroke patients accompanied by CD4 and CD8 immune cells. So that means the body didn't like the spike protein in the brain. It was kind of attacking its own brain tissue, and that was probably what was contributing to these strokes. To these
And it
strokes. So
was highly inflammatory. Of
yes,
course, yeah.
highly inflammatory. So they looked in all these cases. See S protein here. This is the spike when they
Yeah.
see this green here. And then we have they looked in controls and they did so much really. I mean, it's so much to even go over today, but
Okay, and their conclusions are that indeed there is evidence of the spike protein being produced by so many different tissues. Okay,
yes,
well, I guess in another time we will be receiving you. We will discuss now about large data sets with general population, but this, I mean, as a conclusion, is already breathtaking and not in a good way. That we've been lied to that much. And then, of course, as a public health professional, you also have reviewed works on on general population with more than 300,000 patients. There were a lot of Italian studies being published. Well, we'll go through them another time, but this is already, as the British say, flabbergasting. This and this should be cause for indignation, because it is, in fact, it's not that it should be forbidden to lie to the public that much. It is forbidden already. This is violating the statutes of man, as they say in pretty much every country of the northern hemisphere, and I'm quite sure pretty much every country of the southern as well. That we would have been told that this stayed in the arm and it didn't, and we would have been told that there were no adverse effects and there were. We would have been told that the spike protein could not be produced after a long time, and of course it was. And this is peer reviewed. I mean, we're not talking about the happy conspiracy theories blog of Winchester or what have you. We're talking about like top peer reviewed publications, and and there, I mean, we've been asked to trust the science, right? Well, this is science. This is science. So this is what we should trust. This is peer-reviewed science by top teams in top journals, and it's all concurring to the fact that we've been lied to. So, of course, these people don't have the authority to sue, don't have the authority to serve subpoenas and make sure the people responsible for those lies, which have been endangering the lives of virtually billions of people around the world, because more than 4 billion people have been injected, two shots with those. That those guys be subpoenaed, of course, is not the responsibility of those Japanese teams or of the McCullough Foundation, even though I really hope that the McCullough Foundation will be cited and quoted in further hearings about those, because this is, I mean, the legal term that comes to me after seeing the evidence that you've been so kind to show us is crime against humanity.
You're spot on. You hit the nail on the head. Crime against humanity. Your whole audience, everybody watching, you just saw vaccine components, mRNA, and produced spike protein in vital organs of humans that died from these shots. So you saw it firsthand. It's there. Governments have to acknowledge that, and they should apologize to their citizens for pushing this and even mandating it in many cases with vaccine passports on their innocent populations, and unfortunately harmed so many.
Well, thank you so much, Nicolas Hulscher, for that. You are a master of public health. I ought to remind our friends in Europe that this is one of the most bankable masters. So you could have, taken a very lucrative career. In fact, working for some of the top pharmaceutical companies who are responsible for this disaster. And well, instead, you decided to serve the people, and we're extremely grateful for what you've been doing. We're looking forward to having you on the show again. We're recommending people to have you on their show. I'm thinking about Redacted, Clayton and Natalie Morris. They've got a top show in the United States that you should definitely go to. Maybe Candace Owens, I don't know, or maybe any other show that you would be sympathetic with. The Joe Rogan Experience would be good in many respects, and I think you completely warrant being received on that show. In any case, it's been an honor having your presentation and showing this evidence with you. You've been extremely professional, and I'm quite sure my audience is grateful to have had you on the show. The tradition here is that we give the last word to the person being invited.
Well, thank you so much for having me. Thank you for those kind words. And I just want to give a message of positivity, right? So there's so much negativity now. People are so upset with their governments for pushing these products, for the pandemic debacle, for the lockdowns. People are so angry. But I think now a majority of people in the world realize the fraud and the crimes that have taken place, and there has been this what we could call a mass awakening of what's really happening. And so I think we can have a really positive future if we keep telling the truth, We don't give in to mandates. We don't give in to nonsense, and we reject any more mandated genetic products that are forced upon us. And I think we can have a really positive future.
Nicolas Hulscher, thank you very much.
Thank you.